So just before, I can't see any comments coming through, but oh yes, better. Okay, great. We have done about 10 minutes or so, but because internet connection was so poor, I might just quickly go back over what I've spoken about. So Jess, as you can see, is hosting this Instagram live, and my name's Nicole, and I'm a pediatric emergency nurse and the founder and educator at Rhythm First Aid. So I have over 10 years experience as a pediatric nurse working in education, emergency and on medical wards as well. And so I've cared for probably thousands of children that have had respiratory illnesses, from babies that are a couple of days old through to adolescents as well. So this Instagram live, we're just going to be chatting about the respiratory illnesses that your little ones may or may not have. This winter, your household may have already been hit with a few different respiratory viruses, but important to know that respiratory viruses, and for that matter all types of viruses, are very normal, and often within a little person's first few years of life it's considered normal for a child to have up to 12 viral illnesses per year, and often those illnesses are crammed into that sort of winter period, so it can feel really, really relentless of them constantly being sick. I know that some of you are maybe yet to experience this, and others may be in the thick of it, or hopefully you may be, it absolutely does not happen to everyone, but just good to be aware of. So a respiratory virus, so a virus is a virus and it's not bacteria, so antibiotics don't work as a first point. With respiratory viruses, often the symptoms that your child or baby has a respiratory virus is that they may have a cough, they may have faster or harder breathing, they may have a runny nose, they may be a little bit more unsettled, and often they may have a fever as well. So all of these different signs and symptoms can indicate that a baby or a child has a respiratory illness. There are a few questions that came through in the question box that I'll answer as we go through. If you have any more questions, please feel free to write them in the chat and we'll answer them as we go along. But the first topic that we're going to talk about is fevers, because this is by far the most common topic that we get lots of questions on, and it's a topic that has a lot of myths and misconceptions associated with it as well. So we know a lot about fever, and we know that it's actually really helpful in the body fighting off that invader, so whether that be a bacteria or in this case a respiratory virus. So fevers are not harmful, they're actually helpful in fighting off the infection. So it's important that you remember that, and it's important to also understand that the number on the thermometer is not indicative of severity of illness. So if your baby's temperature is 39.9, they're not necessarily any more unwell than a baby that has a temperature of 38.2. So when the body temperature hits 38 degrees, that's what we consider to be a fever. And so the body's heating up. It's an immune response to fight off the infection. So there's a bit of an exception to that, and that is if your baby is under the age of 12 weeks and they have a body temperature over 38 degrees, then you need to seek medical attention. Your baby needs an assessment by a doctor, and usually the way that you obtain that is by attending the local emergency department. With fevers, the most accurate way to check a baby's, if they have a fever, so to check their body temperature, is using an under-the-arm thermometer. You can get lots of different brands of thermometers. There's forehead thermometers, there's ear thermometers. They may be relevant for different stages of lives, but with a baby under the age of 6 months, an under-the-arm thermometer is the gold standard, and then over the age of 6 months, you can still continue to use the under-the-arm thermometer, but an ear thermometer is really helpful. So if your child has a fever and they're over the age of 12 weeks, it's far more important for you to assess and be mindful of any symptoms that they have, and also keeping an eye on their behaviour, their breathing, and their hydration levels as well. So that's sort of a bit of a fever 101. Just remember that 12-week rule. So if a baby has a fever under the age of 12 weeks, that you need to go to emergency. Otherwise, you may be able to manage at home if your baby's breathing is okay and they're feeding well too. If your baby has a virus, of course, they may be feeling a little bit more sleepy than usual. So you would want to, have a bit more quiet time. They might want to sleep a little bit more, and that's okay. So certainly promote rest and try and get some rest yourself. In regards to fluids, so babies can become dehydrated quicker than older children and adults. When a baby is unwell, they may not be as interested in feeding, whether that be from the breast or the bottle, or eating if they're of an age where they've started eating. If they are eating solids, it's not important for them to eat when they're unwell. It's far more important for them to be drinking to maintain their hydration levels. If they are interested in eating, you can offer them some fluidy foods. But with their hydration, the golden rule that we have, sort of like a blanket rule to help you decide if your baby is becoming dehydrated or not, is that we want them to be having at least 50% of their usual fluid intake. Now, this can be tricky if you're breastfeeding to try and gauge exactly how much fluid or milk they're drinking, but roughly 50%. And then the way that you can assess that is the weight of their nappies. So if you're used to changing the nappies all the time, you roughly know, like, oh, geez, that was a heavy one or that was a light one. Roughly 50% of their wet nappies. There's a question that someone's written, how can we check the hydration? So by the weight of the nappies is a really good one. Another thing that you can do is just by looking at their mouth and looking at their lips, seeing if a baby's lips are becoming a bit more dry. There's a couple of other things you can do. One might have taught you before to check a baby's fontanelle at the top, which is the soft part here. If that's really sunken, that can be a sign of dehydration. But generally, if your baby's starting to get dry lips, it's a sign that they're becoming dehydrated, and we'd want you to be assessed by a doctor. So I don't want to overcomplicate it too much. Sometimes when a baby is trying to feed, they may be becoming annoyed and a bit distressed because they may either be in a bit of pain or discomfort, they may be tired, or they may have a blocked nose. So in helping a baby or a child through a respiratory illness, it's important that you're doing exactly that, symptomatic management and helping them through the illness. So offering them pain relief. So paracetamol, can be given to a baby over the age of 1 month, and ibuprofen can be given to a baby over the age of 3 months. It's safe to give these two medications together at the same time if you wish, or you can choose to alternate them. And of course, always following the directions on the bottle. But they do work really well together, and making sure you're writing down the times of when you're administering those pain medications. The role of paracetamol and ibuprofen is to not bring down the fever. Like I've said, it's the high fever is not concerning, it's not harmful to them. The role is to make them more comfortable, and increase the likelihood that they will drink and maintain their hydration levels, and to alleviate any pain or discomfort that they might be in. Are you happy for me to keep going? I feel like I'm sort of talking quite quick.
We do have a few questions.
Sure.
Here, but we kind of want to keep chatting about
or fevers.
Ask
a reason why the temperature under the arm
for that.
Yes, so this is by far the most accurate way, and the only way that you should be checking your baby's temperature is underneath the arm. The reason why this is because the infrared and forehead thermometers, there's not a lot of research that they work in infants, that they're actually quite inaccurate. And if you head onto our Instagram page, I've referenced a couple of studies that have been done that talk about the inaccuracies of these thermometers in babies. And the reason why it's really important to use an under the arm thermometer in a baby is because if they're under the age of 12 weeks, we want to know if they have a fever or not. Because they can become unwell quite quickly, and so we want that number to be accurate. When they're over that 12-week mark, it's not as vital, but still we certainly recommend the under the arm thermometer at least minimum to 3 months, if not 6. And then from 6 months old, you can use a tympanic and ear thermometer. But you can't really use an ear thermometer on a newborn baby because their ear canal is too small, so it also won't be accurate. And
what, other than temperature, that's obviously one of your first warning signs.
Yeah, so other symptoms to look out for are increasing lethargy. So if someone was really, we expect them to be sleeping a little bit more, but if they're really drowsy, really lethargic, hard to wake, that would be concerning. The other concerning symptoms is their breathing. So if they were breathing really hard or really fast, so you might see sucking in around their neck and around their ribs. So it's a good idea to, when you're changing their your little bub's nappy when they're unwell with a bit of a cold, to lift up their top when you change their nappy, spend a couple of seconds assessing their breathing to ensure that it looks normal. If you had any concerns, you'd keep a closer eye on the breathing. But yeah, so it's usually dehydration, lethargy, and increased or faster breathing are the things to look out for when a baby has a cold or has a respiratory illness.
I guess it's quite natural for a parent to be concerned when they kind of notice those symptoms. At what point do you decide that it can be treated at home, or what are the more serious?
Yes, it also depends on that age of the baby or the child. It depends. This might be your first baby and the first cold, so your threshold is a lot lower, and that's okay, to go and see your GP, to get that reassurance, to have a hydration assessment to make sure that they're okay. This might be your, third child, and you've managed multiple viral illnesses before, so you feel a little bit more confident, you know what to look out for. Certainly if you have any doubt in your mind, it's recommended that you have an assessment completed. But yeah, if they're really hard to wake, if they're really lethargic, if they're not drinking, if the fever's been going on for more than 48 hours, or if they just don't seem quite right to you, if you feel a bit concerned about some of their symptoms, then you can certainly see your GP as the first port of call. You can, depending on where you live in Victoria, we're really lucky that we have a virtual Victorian emergency department, and I'm sorry to those that aren't in Victoria, because that's just for Victorians at the moment. But of course you can call the maternal child health helpline. Nurse on call sometimes can provide you with that information, and then naturally there's the emergency department that you could attend as well if you were concerned. It's also really important, if you've got a baby under the age of 4 months, that if they've got a really runny nose or a really blocked nose, it's going to make it really challenging for them to feed, because they breathe mostly through their noses. And so if they've got a blocked nose and they're trying to drink, the air is not able to travel in and out of the nose. The way that I describe it to parents is, although you put a pair of socks in your mouth and then you've got a blocked nose, but you can't blow your nose either. So it makes it really tricky. So you can spray a saline spray up the nose to help clear the secretions and the boogers about 15 minutes before a feed. Or you can also use a suctioning device, an aspirator or a snotty boss, to help suction out the nose to make sure that they will feed, because that's probably one of the biggest things as well, particularly in the smaller babies, making sure that their noses are cleared out as well. Another question that I saw was about coughs and nocturnal, so nighttime coughs. So some babies and children cough a lot more than others. Sometimes the coughs are just in relation to the viral illness. Some kids cough and they have this sort of tight persistent cough, and it can be a sign of asthma. Some kids could have like a really barking seal-like cough that could be a sign of croup. But a lot of kids have sort of a productive mucousy cough when they are unwell. And cough medicines are not recommended in children under the age of 6 years of age. And the child that's coughing, although it can be quite distressing for them and for you as a parent or a care provider, it's actually a good thing that they're coughing and moving that mucus around. With coughing, like I said, you can't really give cough medicines. They're not recommended. However, something that you can do to help with the cough is to give them honey. So there's some evidence that supports the use of honey to reduce the severity and duration of a cough. So you can have a teaspoon or two of honey before bed at night, but honey should only be given to children from their first birthday onwards. Honey should be avoided in babies under the age of 12 months.
That's really interesting. Really useful information for a lot of people. Another thing I people want to look into the cold months, any measures you can take to prevent
it just
these colds.
Cut out a little bit, but to clarify, did you say ways to prevent the respiratory illnesses? Yeah. There's lots of myths. I'm sure that people have heard about the myths of, don't go outside with wet hair, you'll catch a cold, or don't go to sleep with wet hair, you'll catch a cold. They are simply that. They are myths. We know a lot more about viruses than I'm sure everyone's grandparents has said that to them, that, you'll catch a cold. In order to catch a cold, you need to be exposed to the cold virus or respiratory virus. And so ways to prevent a cold is to try your best to avoid people that have colds, but they're really common during winter because lots more people are inside. We're not spending as much time outside, and particularly in that age group where babies and children become a lot more social. So childcare, daycares, play groups, things like that. They're sharing toys. They're very loving, up in each other's personal space, and a respiratory virus is shared by shared, or someone contracts it via, depending on the virus, but droplets and things like that. So in order to prevent a respiratory virus, it's to try and prevent exposing your child to kids that are sick. But in saying that, you can't be in a bubble forever, and the advantages and the pros of children seeing other children for socialising and their development in childcares and play centres is super important as well. So often it's a bit of a balance. But yeah, there's not really a lot you can do. Some people, try different things like different supplements and things. There's not a lot of evidence to support that they work. Just that it's recommended for a well-balanced diet and lots of sleep where possible to help support your immune system to fight off the infections. Yeah.
Pretty much the questions that we had come through earlier, but if anyone else has questions, just comments. Maybe Instagram as well. Nicole, thank you so much for joining us today.
Pleasure. Thanks for having me on. Have a good afternoon, everyone.